And now to one of the fastest growing and deadliest cancers you've probably never heard of, esophageal cancer.
It's a cancer of the food pipe or the gullet, and there's been a staggering 600% increase in the past 10 years. About 700 people are diagnosed with esophageal cancer each year, and the numbers are expected to double in the next decade.
85 to 90% of those diagnosed die within 5 years. And joining us now, Sunrise GP, Dr. Ginny Mansberg, and esophageal cancer survivor, Lyndon Jay. It's great to talk to you both. Thanks for coming in. Ginny, first of all, 600% increase in this cancer. Why is that?
That's in one particular type of esophageal cancer. So overall, it's been a 400% sort of increase. The reason is mainly reflux. So it always was a sort of cancer that you got with smoking and drinking and all those lifestyle things. But reflux, which is really common, about 20% of Australians sort of have regular reflux, can eventually in 10% of people cause these precancerous changes, and in a certain percentage of those it will go on to become cancer. And we're seeing massive explosions in this reflux because we're gaining weight and our lifestyle isn't so good and our diet isn't so good, and that's why we're seeing a big explosion.
Oh, really?
Yeah.
Well, is that just, I mean, some people have pointed the finger at the rise of the soft drink as a standard item in that. What are your thoughts on that?
No evidence for that. I mean,
No?
some people do find that they get a little heartburn after a bit of Coke, but it's pretty much whatever causes regular heartburn increases your risk.
Lyndon, you were diagnosed with stage 4 cancer. You're obviously doing pretty well at the moment. What were your symptoms, and what did you seek to do about it?
I had an early symptom 12 months before I actually got diagnosed. It was just a small cough. But then 3 months before I got fully diagnosed, I wasn't able to swallow food completely. And I couldn't complete a meal. And I used to get a lot of pain down in this area.
So what did you think about that at the time?
No idea.
Yeah, right.
Hello, doctor, what can you do for me? And we started a whole process of tests to find out.
With so many cancers, early detection is the key. There's some suggestion that there should be brochures given out in pharmacies to anyone who comes in for heartburn or indigestion medication to go and see your doctor. That's because a lot of the people suffer those symptoms?
That's right. And I tried taking all of those reflux suppressing medications without success. And if I'd have known there was a possibility of something going on from there, I might have panicked a bit more.
What sort of tests did they run then to determine what was going on, Lyndon?
Initially it was a gastroscope, and then from there they discovered the mass.
Yep.
We went from there. There was 5 visits to 5 hospitals and various different tests, endoscopes, laparoscopies, various things done, and the diagnosis was I had stage 4 cancer. There's probably a much better medical name for it, but yeah, that's where we...
Yeah, right.
Is the reason why there is such a shocking mortality rate with this disease because early detection, you know, there isn't early enough detection of this?
Well, everybody gets a bit of reflux. You go and grab a few Tums or a bit of Mylanta from the supermarket and you ignore it. The longer you've had the reflux, and Lyndon had it for 25 years before he started with the cough and not being able to swallow, the worse the prognosis. The more often you get it, the worse the prognosis. And it's not the sort of thing that you should just be, you know, medicating yourself with a bit of, you know, Mylanta from the, you know, from the pharmacy or the supermarket.
And it's mostly older people who are being diagnosed with esophageal cancer, presumably just because they've had greater or longer exposure to the things that may cause it.
But with any cancer, when we see the numbers explode, you're also going to get some younger people getting it as well, you know, just because the entire numbers go up. So we're starting to see more and more young people get it, although the vast majority are even older than Lyndon.
Yeah, right.
Lyndon, as we said in the introduction, it's a cancer that not many people have heard of, not something that you necessarily knew about. What is the message that you want people at home to know?
The real message they need to take away from this is if you've got any doubts, go and get yourself checked out. Insist with your doctor that you see a gastroenterologist and that you get a scope goes down and has a look. After my diagnosis, all of my mates went and had gastroscopes and 2 were found to have Barrett's disease.
Wow.
Really?
Which is that precancerous thing that we were talking about.
Okay, so just to confirm, you know, trouble swallowing, persistent reflux, niggling coughs, these are the things that you should be looking out for.
Feelings of heartburn.
Only 60% ever have heartburn, so in 40% of esophageal cancer patients, they never ever get the heartburn. So of course it's the biggest warning, but it's not the only warning sign.
Well, Linda, thank you so much for sharing that with us this morning. Glad to see that things are going well at this stage. Good on you.
Yeah, best of luck.
So far, so good. Ginny, thanks as always.
And now the reason that we're covering this story today is we were told about it by Polly Grundy, whose husband Mark passed away 3 years ago today at the age of 49 to esophageal cancer. Now, Polly is behind today's inaugural Esophageal Cancer Day. She's also started a support group, and all of those details will be on our website.